Ocular Cicatricial Pemphigoid, or OCP, is a rare and chronic autoimmune disease that primarily affects the mucous membranes of the body, most notably the conjunctiva, the clear membrane covering the white part of the eye, and the inner surface of the eyelids. It leads to inflammation and scarring, potentially causing severe vision impairment and even blindness if left untreated. This video will explore the intricacies of OCP, providing valuable information about its causes, symptoms, diagnosis, and management. The exact cause of OCP remains elusive, but it's understood to be an autoimmune disorder. This means the body's immune system mistakenly attacks its own tissues. In OCP, the immune system targets proteins located within the conjunctiva, leading to inflammation and tissue damage. While the precise trigger is unknown, genetic predisposition and environmental factors are suspected to play a role. Certain medications have also been implicated as potential triggers in rare cases. The pathophysiology of OCP involves a complex cascade of immune responses. Autoantibodies, specifically IgA, bind to basement membrane proteins in the conjunctiva. This triggers the activation of the complement system, a part of the immune system that enhances inflammation. Inflammatory cells, such as neutrophils and mast cells, migrate to the conjunctiva, releasing enzymes and other substances that damage the tissue. Over time, this chronic inflammation leads to scarring, shrinkage of the conjunctiva, and ultimately, the formation of adhesions between the conjunctiva and the eyelids, known as symblepharon. OCP is a relatively rare disease with estimates suggesting an incidence of about 1 to 8 cases per million people per year. It typically affects older adults, with the average age of onset between 60 and 80 years. Women are affected more often than men. While OCP can affect people of all ethnic backgrounds, some studies suggest a higher prevalence in certain populations. Due to its rarity and the potential for misdiagnosis, the true incidence of OCP may be underestimated. The signs and symptoms of OCP can vary depending on the stage of the disease. Early symptoms may include chronic conjunctivitis, characterized by redness, burning, itching, and excessive tearing. As the disease progresses, patients may experience dry eye, foreign body sensation, and photophobia or sensitivity to light. A hallmark of OCP is the development of symblepharon, adhesions between the conjunctiva and the eyelids. In advanced stages, scarring can lead to corneal damage, including corneal ulceration, nevascularization, the growth of new blood vessels on the cornea, and ultimately vision loss. Eyelid abnormalities, such as entropions, inward turning of the eyelid, and trichiesis, misdirected eyelashes rubbing against the cornea, can also occur. Diagnosing OCP can be challenging due to its rarity and the non-specific nature of early symptoms. A thorough ophthalmological examination is crucial, including a slit lamp examination to assess the conjunctiva, cornea, and eyelids. Conjunctival biopsy is often performed to confirm the diagnosis. The biopsy sample is examined under a microscope to look for characteristic features of OCP, such as subepithelial deposits of IgA and IgA. Direct immunofluorescence is a technique used to identify these autoantibodies. In addition, blood tests may be performed to rule out other autoimmune diseases. While specific classifications aren't rigidly defined in the same way as some other diseases, OCP can be broadly categorized based on the severity and progression of the disease. Some clinicians use a staging system that considers the extent of conjunctival involvement, the presence and severity of symblepharon, and the impact on vision. Early-stage OCP may involve mild inflammation and minimal scarring, while advanced-stage OCP can lead to significant vision impairment and blindness. The primary goals of OCP treatment are to suppress inflammation, prevent further scarring, and preserve vision. Treatment typically involves a combination of topical and systemic medications. Topical corticosteroids and lubricating eye drops can help to reduce inflammation and provide symptomatic relief. However, systemic immunosuppressants, such as dapsone, methotrexate, and cyclophosphamide, are often necessary to control the underlying autoimmune process. Biologic therapies, such as rituximab, which targets B cells, have also shown promise in treating OCP. Surgical intervention may be required to correct eyelid abnormalities, release symblepharon, or repair corneal damage. Amniotic membrane transplantation can be used to promote corneal healing and prevent further scarring. Currently, there's no known way to definitively prevent OCP, given its autoimmune nature and unknown trigger. However, early diagnosis and prompt treatment are crucial for minimizing the risk of vision loss. Individuals with a family history of autoimmune diseases may be at increased risk and should be vigilant for any signs of eye irritation or inflammation. Avoiding potential triggers, such as certain medications, may also be helpful in some cases. The prognosis for OCP varies depending on the severity of the disease and the effectiveness of treatment. With early diagnosis and aggressive management, vision can often be preserved. However, even with treatment, OCP can be a progressive disease, and some patients may experience significant vision loss. Recent research has focused on identifying new biomarkers for OCP, which could help to improve diagnosis and predict disease progression. Studies are also underway to evaluate the efficacy of novel therapies, such as stem cell transplantation and gene therapy, in treating OCP. Continued research efforts are essential to improving the outcomes for individuals affected by this debilitating disease.